The healthcare system in the United States is very complicated and very flawed. There are several different rules and regulations: funding, enrollment dates, out of pocket costs for employer based insurance, private insurance from healthcare.gov, Medicaid, Medicare, different tiers of coverage, including highly deductible plans, managed care plans, and free for service systems. Ultimately, there are three big problems with the healthcare system in the U.S. First, there's no universal healthcare. The U.S. government does not provide health benefits to citizens or to visitors. Anytime you get medical care, someone has to pay for it. Next, healthcare in the U.S. is very expensive. According to the U.S. government website, if you break your leg, you could end up with a bill for $7,500. If you need to stay in the hospital for 3 days, it would cost roughly $30,000. Costs are rising for several different reasons. First, there's an inefficiency with multiple different systems that increases costs, such as administrative costs that make up about 8% of all healthcare dollars. High drug prices are the biggest area of overspending in the U.S., where there is no regulation on drug prices. This lack of regulation allows unethical corporations, such as Valeant and many others, to overcharge customers and force them into extreme financial deficit. Finally, most people in the U.S. do not have health insurance. Health insurance protects you from owing a lot of money to doctors or hospitals if you get sick or hurt. To get health insurance, you need to make regular payments to a health insurance company. Unfortunately, in the U.S., there has been very little attention to the issue, and a lack of political backing has prevented the government from taking a larger role in controlling the cost of healthcare. The Affordable Care Act focused on ensuring access to healthcare, but maintained the status quo to encourage competition among insurers and healthcare providers. While Americans are highly disappointed with their healthcare system, Canada's system of universal healthcare has long been viewed as an alternative, superior model for the U.S. to follow. Canada's single-payer system is mostly publicly funded and has high levels of satisfaction among its own population. Canada provides universal access to healthcare for all of its citizens, while nearly 1 in 5 non-elderly Americans is uninsured. In Canada, coverage is not tied to your job or dependent on your income. Rich and poor are in the same system and enjoy equal access. Canada's Healthcare Act has 5 policies. The first is a public administration. All administration of health insurance must be carried out by a public authority on a non-profit basis. The second is comprehensiveness. All necessary health services must be insured. The third is universality, which requires that all insured residents are entitled to the same level of health care. Next, portability states that residents who move to different provinces or territories are still entitled to coverage from their home provinces. Finally, accessibility requires that all insured persons have reasonable access to healthcare facilities. The cost of healthcare in the U.S. is something that has impacted my life greatly. Unfortunately, I have several different medical conditions, have had 7 different surgeries, and have spent a lot of time in the hospital. A large portion of the reason I've worked and had a full-time job while going to school is because I was fortunate enough to be covered under an employer-paid plan, as I knew there was no way I'd be able to cover the costs myself. Ultimately, I believe the difference between the healthcare policies in the US and Canada is the different core values between the two countries. In Canada, everyone is treated equally regardless of their socioeconomic status or any other factor for that matter, by being provided with the same healthcare plan and service. The same cannot be said for the US, unfortunately.